Hello everyone, my name is Lulu Achua. I am going to be demonstrating on how to carry out a gastrointestinal and a genitourinary skill. Before every procedure, I have to identify my patient with the two form of identifiers, which is by asking them to tell me the first and last name and date of birth. And by so doing, I will also cross check with their armband to make sure I am working with the right patient. We have to introduce myself to the patient. I wash my hands. I explain the procedures that I'm going to be doing to the patient. I gather my equipment and I provide privacy to my patient. Before I start, um, I have to ask the patient some questions. Like how their appetite has been, if they've been having problems with eating, if they've been having issues with tolerating food, the kind of meal they take, if the consistency, if it is a regular meal, if it is a puree diet, if it is a mechanical soft diet. I have to ask them all of that. I ask them about their current medication they're taking. I ask them of how they do, how they pass out urine, whether it is normal or whether it is painful, whether they have a difficulty urinating, whether they have any issues with the prostate, or if they've ever had a prostate cancer before, or any prostate examination done. I'll also have to find out if they have foul, if they notice any strong smell in their urine when they pass out urine. I'll ask them of any surgical history, and if they've ever had any complications, medical complications in their lifetime. Then I have to inspect the contour. I have to inspect for symmetry. I also check for masses. If there is anything, I note it down, and um, I inspect the skin for the color. I check for turgor. I check for piercings. I check for striae gravidaria if it's a woman, or just general striae. I check for scars or scar tissue formation. I check for stretch marks, skin coloration, um, skin tags, um, any issues with the skin, dry skin, and all those I check in the skin. And then I palpate for movement, position movement. I inspect the hair for even distribution. I inspect for cleanliness, for check for lice, check for dandruff on the hair, and I auscultate the bowels for the sounds before I do PCOS. That word is always difficult for me to pronounce. I'm sorry. And then I palpate the abdomen for to get the bowel sounds, and I auscultate the left lower quadrant, the right lower quadrant, the left um, left lower quadrant, left upper quadrant, the right lower quadrant, right upper quadrant. Yeah, and then if there is any differences in any of the quadrants, I have to note it down, and I auscultate for vascular sounds. I auscultate areas like the aorta, the renal, the iliac, and the femoral. And then I also have to, because all four quadrants, starting in the right lower quadrant and working clockwise. Because the liver, beginning from the right side and then going towards the left side. Because the spleen, because the CVA for tenderness, and assessing for pain. And then I will also have to carry out palpitation. I monitor the facial expression while I'm palpating, while I'm doing anything. The facial expression will tell me if they are in pain, if they are having discomfort, if they cannot support it anymore. Some will not verbalize it, but it will show in the face. So that is why when I'm doing the palpation or any of the examination, I'm checking the patient, I'm watching them on their face to check for facial expression. I perform deep palpation on all four quadrants. Um, I palpate the liver, I palpate the spleen, I I have to check on the patient how they do go to the bathroom, if they have if the physics is hard, if the consistency is soft, if it is loose like diarrhea, or if it is too hard as constipation. I have to check on all that. And then genitourinary, on that area, that is where I check where the patient, how the patient goes to the bathroom, and all the assessing of the color, the odor, and the consistency of the urine. And a testicular examination will be done if it is a male. And then I complete the exam with by discussing all my findings with the patient, or if it's in the case where the patient cannot comprehend, the relative or family member that is with the patient, I have to tell them my findings. And after explaining all my findings to the patient, I have to document the findings, and I make sure it's documented on time and in the proper way, um, following the facilities documentation process. When all that is done, I undo my gloves if I were wearing one. If it's not no glove, then I wash my hands and I leave the patient's room. Thank you.